So I want to actually, and I want to throw this open to everyone, Swami, please chime in on this. We have the fact that there is an Ayushman Bharat, there is insurance that companies provide to their employees, there is insurance that individuals purchase for themselves and their families. Is all about paying for when you fall sick and you need hospital-based care. Okay? When some of these companies do offer it, it is more of a marketing gimmick that they say, oh, you can go and get a health checkup done. But there is nothing happening after that. Hospitals, like you pointed out, tend to use that to try and push you. So today you have hospitals that might do a calcium CT scoring to say that your arteries are broad and that may I do an angioplasty for you, because that's where the hospital would get paid. So how do we change that method? That is, how do we pay for healthcare? Any thoughts around that?
I just want to add a couple of comments, right? One is that I think we talk about many things, we get frustrated about many things, but we should do a root cause analysis and fix the problem at the root cause. Not having enough primary care physicians cannot be solved by training more physicians. The reason we don't have enough primary care is not because we don't have enough doctors. We have enough doctors. India has enough doctors. It is just that doctors don't find it attractive to practice primary care medicine. Right? So I think we have to look at the solution from a market perspective. What do we do to make it attractive to be a primary care physician? Which is why we have proposed in the book that we eliminate the primary care physician, call them comprehensivists, and have them have attached to them teams of community health workers who are not like ASHA workers. A community health worker is 95% a doctor, in the sense that they can do almost everything a primary care health physician does today, and through a telemedicine linkage can provide care at the doorstep, which today many primary health care physicians cannot provide because they don't have that linkages. So we need to solve healthcare problems by understanding the root cause and designing the market to provide the right incentives so that people's behaviors are, for example, people talked about prevention. Why do people not take preventive checkups, right? The reason people do not get preventive checkups is because they're afraid of what they will find out. And they're afraid of the consequences of being diagnosed with an illness. Now, how do you solve that? You don't solve that by doing random mass screening. I think what you need to do is have this community health worker visit them in their home every month or every 3 months, observe them, form a trusted relationship with them, and then as part of the trusted relationship, provide preventive care services and early diagnosis of things. For example, many diseases can be stopped when they are just emerging. So the solution to that is not to kind of overdo on the service side. It is to solve the problem. What is the problem? The patient does not trust the healthcare system, does not want to go visit a hospital, does not want to go. Here you have a community health worker who's almost like a family friend, who you expect every 3 months. You're almost having chai with them, you invite them into the living room. They talk about your family, they know when your daughter is getting married, you exchange gifts for the festivals. Now that person tells you, auntie, why don't you get a sugar done? You will do it. And if that person tells you, your sugar is a little high, why don't you lose a little weight? You are more likely to do it. That is what we have to bring about. So what I'm saying is rather idealistic, but it's, unless we do this, we are going to, I think anything else like providing more doctors or more of this and more of that, supply-driven mechanisms will not on their own work. If you train more doctors, more of them will practice in cities, prescribe more expensive medicines to more people, just increase the average cost of healthcare